the data that Dr. D'Angelo presented was really a culmination of multiple phase 1 and other experiences, and essentially showed that in this large patient population that the overall response rate for this approach was greater than 40%, which if you look at it in the context of what do we see with chemotherapy, because synovial sarcoma is one of the diseases where we actually do see some activity with chemotherapy. Many of the patients had received prior therapy, 2 or more lines of therapy. And if you sort of try and parse out, this response rate and what does it mean, compared to what we see with systemic chemotherapy, it is actually higher. So it really looks like a very compelling approach to taking care of patients with synovial sarcoma. I think the questions that we have or need to think about is, where do we introduce this therapy? Do we do it early on? Do we wait till patients have limited options? Probably early on makes more sense because the benefits seem to be in patients who had lower volume disease. And I think also the challenges about using this therapy is it's not simple. Patients have to be screened for the appropriate HLA type. And certainly there are some races for which that is the likelihood of matching is, 25% or less. So that's a question of sort of the access for all of our patients, and also the infrastructure that's required to give this therapy. It is, costly, it requires expertise, and so this is going to be something that in some parts of the world patients are not going to have access just because of limited healthcare infrastructure.